So welcome to the Global Business School for Health and our session on scholarships and funding information. I'm, as I said, Professor Nora Colton. I'm the director of the Global Business School for Health, and I'm really excited to have the opportunity to talk to you about scholarships and funding. So just a few housekeeping rules. Your chat function does not work. So if you want to ask some questions either before or after, just put them in the Q&A and I will answer them at the appropriate time after I finish this presentation. So I'm going to take you through a presentation and then we'll have some time at the end for your questions. So first of all, I just want to talk a little bit about who we are. I assume if you come onto this call, you know who we are, but just in case, I'd like to take a moment to tell you a little more about the school. So first of all, we are the first business school for health in the world, totally dedicated to educating the next generation of health and healthcare managers and professionals. And this really is a significant and exciting moment for us. You know, healthcare and health are probably the most pressing issues of the 21st century. I know people will say climate change, but climate change will have implications for your health. And so it really is important that we get our health systems sorted out and in a place that they can operate efficiently and effectively for all of us, not just some of us. And so part of what we do at the Global Business School for Health is we really reimagine global healthcare management. We do that in a number of ways. We've got a number of master's programs as well as an MBA, and we try to really break down those barriers, look at the system. You know, we hear lots today in the health and healthcare sector about more focus on preventative medicine, the need to think about, you know, primary care as the focus of our health system. We need to think about how private and public partnerships work together to create an effective health system. So that's all about, you know, unraveling those challenges. And we do that really by using business practices and thinking about management and health management in its widest definition, because we believe at the Global Business School for Health that those solutions from business, if contextualized correctly and thought about, can really make a difference for health and the health sector as well as other sectors within the economy. So as I mentioned to you, we've got a number of really exciting programs. We have our flagship program, which is the UCL MBA in Health. It's launching in September. It's really an opportunity to have really quite a unique experience. The program is designed like no other healthcare program that you would come across in an MBA. And why is that? It's because we use the case study approach. Many of you will be familiar with that. But moreover, all the cases within everything we do is around health and healthcare. So you get everything that's in a general MBA. You get that decision making, that opportunity to really speed up, you know, what many of us have spent years and sometimes decades of getting experience to do. By making decisions, learning how to use ambiguous information, understanding really the health landscape and the health ecosystem and how it's changed over time. But you also get all the parts that you would expect in an MBA. So you'll learn about strategy, you will marketing, you know, human resource management, you know, economics and health economics and digitalization and innovation and funding and finance and accounting. So it's really such a comprehensive program. And then it's got two really incredible experiences and experiential learning. One is of course, our exciting global health challenge, where you get to go work on a project in another country and you spend 2 weeks doing a field component as well as a health consultancy. We've also then have 3 masters. And if I can just mention on the MBA, in 23-24, so if you're thinking for the, not this coming year, but the year after, we'll have our executive MBA. And that's designed more for working professionals, people who are a little further on in their career, who would like a part-time program. It's mainly online. There are 1-week residential experiences built into both the first and second year. It's 2 years to complete that program. It's an excellent program and a real opportunity for people in work to get the MBA experience that we offer here at UCL. We'll also, by the way, be launching in 23-24 and recruiting next year for a DBA in health, a doctorates in business administration health. And again, that'll be a part-time program. So keep your eyes out. That's not on our website, but it'll be up shortly. We have 3 master's programs, though, that we've already launched and recruiting to, and they'll start in September. One is our MSc in biotech and pharmaceutical management, an ideal program for people who are really interested in getting into these dynamic sectors. And although we hear a lot about fluctuations in the economy, health and these related sectors will continue to grow and expand because there is such a demand versus the supply. So there's real job opportunities by understanding not just the science, but really that broader perspective that you'll get in this program of learning about the sector dynamics, the clinical trials and statistics, pharmacoeconomics, supply chain management, capital, and private equity markets are just to name a few. And then we also have our digital health and entrepreneurship program. Again, another exciting part of the health ecosystem that's integral, particularly given workforce shortages and the ability to have people own and manage more of their health care. And so that program really focuses on med tech, health tech, but moreover, that kind of startup space, which is really driving forward for this health, digital health sector. And then last but not least is our MSc in global healthcare management. And this one, we spent a lot of time talking to employers and doing surveys. And we've identified 3 routes that you can take on that program. There's one in analytics, where you'll learn about health analytics, one in finance, really about financing healthcare, and then of course leadership, which is such an important topic today, both in the UK and abroad, as we think about the kind of organizational culture and changes that we'll need to make, the structural changes to really deliver on the promise of universal healthcare. Now, one of the things about all of our programs, whether it's the MBA or your master's, is you'll be engaging in projects. You'll work on projects. Some of those projects may be coming up with an innovation if you're on the biotech and pharmaceutical management or the digital health and entrepreneurship program. But even if you're taking the global healthcare management program, you'll be working on a healthcare improvement. So you'll learn how to design a business case, how to pitch your ideas. And these are really important skills that'll last you a lifetime. So really exciting programs. But as with anything, you're going to need to think about how you're going to finance your education as you go forward. So if I start out with our MBA in health, this full-time program is $45,000 a year. It starts in September 22, and of course you can take it in September 23. You can take it as a 12-month full-time or a part-time 24-month. It is delivered in blocks, so you would have to be able to attend during the different block periods if you were to take it part-time. All of our programs are located at UCL East, which is UCL's additional site here in London. It's on the Olympic Park, the Queen Elizabeth Olympic Park near Stratford. It's just a fantastic build and new facility that UCL is so proud of. And then on the MSCs currently, if you're a UK student, those are 16,500 and 29,400 for overseas students. Again, we've already selected our class for September 22, but we'll be opening up in October for applications for September 2023. And these programs, again, can be done either as a full 12 months or a part-time 24 months. So here's an example, just looking at the MBA, thinking about what's included in those fees and how the payments work. So first of all, if we're thinking about our full-time MBA, it includes all your study materials, your registration, your tuition, exams, resits, your graduation ceremony, meals and all activities and ground transportation, for your global healthcare challenge, but also while you're in London, if you go on any trips or anything, we'll arrange the transportation around that. What it doesn't include, though, is this, you'd have to pay for your own accommodations and your flight if you, when you go for that 2-week experience. So that would be an additional cost you'd have for this MBA. Now, how does the payments work? Well, if you're a part-time student, you'll, over 2 years, each term, you'll pay $7,500. And if you're a full-time MBA student, you'll pay $15,000 for 3 payments. Now, it works the same way for the MSCs. There is no charge, no interest charge for this installment program. All the programs are paid in installments. So you'll pay 3 equal installments, so depending on the tuition, depending if you're full-time or part-time, you can figure that out for yourself, I hope. And you'll take your first payment will be just before you start enrollment. You'll have a second payment at the beginning of term 2, and then a third payment at the beginning of term 3. So how much does it cost to live in London? And as we know, costs can fluctuate. They can fluctuate not just because of inflation, they can also fluctuate because people have different tastes, preferences in terms of housing and food and these sorts of things. So these are averages. So just to give you a sense of costs, some of you might be able to live on less. Some of you will need to live on more. So rent is about 166, average weekly spend. Your household bill is about 8. If you're traveling back and forth from 2 locations, you can expect to have about a £15, and you can get a student bus pass that can be used on the buses and the tube. Food around £30 a week. Course material, which I don't anticipate you would have, but maybe you'll want some supplies around 4, your mobile phone around 4, going out maybe 12. Some of you, that might be really off the mark. And then clothes, healthcare, other things around 14. So that's just, like I said, that that's not an exact science, and you might want to sit down and make your own budget and decide. Those are just some things that you might think about as you think about putting together your budget, thinking about how many weeks you're going to be in London. If you're coming from overseas, will you travel back home during your time with us? Will you want to travel around Europe or some other parts of the UK? All of those things you want to kind of think through and get a budget that's coherent so that you understand how much is the true cost of coming to school at UCL is going to have. So of course, getting your costs is just part of the story. Then it's looking at your funding options. And we're constantly looking at ways in which we can improve the number of scholarships and opportunities for our students. So please keep an eye on our website. If you're thinking of coming in 23, 24, we're hoping to launch some new scholarships that we'll put up onto our website as soon as we've got them secure. Right now, though, we do have some scholarships we offer through the school. We anticipate continuing those scholarships, and as I said, actually enhancing them and adding some other scholarships for 23-24. UCL also has scholarships and bursaries you should take a look at and hope to apply for. There's also, if you're a UK student, there's government loans that you can apply for. There's other funds and additional support. So let's start out and just look at the scholarships we have here in GBSH. We have had a kind of a scholarship through Roche this year, but you know, and we'll keep you posted on that award has been made, and we'll be announcing that shortly. We also have our MBA Health Future Impact Leader Scholarship, which is a very generous scholarship offered through the department for MBA students. And again, we hope to enhance that and have a comparable scholarship for people doing our MBA in the coming year. We have a Women's Healthcare Leaders Scholarship, which is for women who people who identify as female. And it also comes not only with a scholarship, but also with an opportunity to do a development program in leadership, some mentoring. And then we've had an East London Healthcare Leaders Scholarship to really celebrate our location and our community going forward. So we're really committed to trying to help as many students as we can make coming to the Global Business School for Health as affordable as can. And as I said, we're hoping to announce in around September time some new scholarships that will add to our portfolio as part of our commitment, because we just believe so firmly that what we're teaching in the Global Business School is not only going to help our students, but society moreover. So I won't go into the Roche Scholarship since we've already made that award for this year, and we'll have to see whether or not we can replicate it next year. But I will talk to you about the MBA Health Future Impact Leader Scholarship, which is up to £15,000. We've made a number of awards for this scholarship this past year. I think as many as 12. This is really for exceptional students who want to undertake our MBA in health. We're really looking for people. You can be a home student or an international student. What we're really focused on is awarding this scholarship to people who want to make a difference in health management, who want to really give back to society, to their communities, and drive forward better healthcare and health. Moreover, we also have the Women's Leadership Scholarship, and I'm really excited that we were able to give 21 of these scholarships out this year. This is up to £5,000, and in addition to getting the scholarship, you will get, as I mentioned, you'll get the opportunity to really have leadership coaching, high impact leadership training as part of this scholarship. So to have an initial group of women healthcare leaders, scholars, to really take this forward is so exciting for us at Global Business School for Health. And then last but not least, again, up to $5,000 for people who either work or live in East London. So you don't have to live in East London, but if you've got a job in East London, you can apply for this as well. And it's really about individuals who, again, want to make a difference in their community, whether they live there or work there. So how do you apply all of these scholarships? Of course, we've got your application. And so you would write a 500-word essay. You can find out more information on these on our website, and then you'd email our admissions inbox and put in the title of the scholarship you're applying for. And then if you're successful, the funds are applied then as a tuition discount when you eventually enroll. Now, in addition to those scholarships, UCL is actually also constantly looking for ways that it can enhance its ability to help people from different backgrounds, particularly people who come from low income backgrounds who want to be part of the learning community at UCL. So UCL has its master's bursaries, and you should definitely take a look at those. The Professor Sir Malcolm Grant Scholarship, other scholarships, International Fee Partnership scholarships. So the Chevening, the Commonwealth, there's the Fulbright, and then of course, as I've just articulated, our department scholarships. So you really want to look around and search out as many places as you can to find scholarships to undertake your degree. As I said, the first step is figuring out the cost, and then the second step is figuring out how you're going to pay for it. So the other thing that UCL has that can be really helpful is UCL has a scholarship finder in which you can put in your details, so if you're a prospective student, the academic year that you're planning to come, what level of study you'll have, the department you'll be in, and then where you're from. And it will help generate a list of the scholarships that you might be able to apply to. Also, as I've just mentioned, the UK government has a scholarships and also loans. So up to a maximum of 11,570 is the amount that you can get a government loan to do a PGT, a master's program for taught and research masters of all subjects. You can for full-time and part-time now, and distance learning. It doesn't do flexible loads, but you should be okay with our programs. And you need to be, of course, a resident in the UK, sorry, you need England, you need to be under 60 years old, and the repayment will be concurrent if you've already taken an undergraduate loan. So it's something to consider. So read about those, look into them, but they're definitely an opportunity for students in the UK. There's also something that I want to really highlight to you, and I very much think it would be short-sighted not to take advantage of this. There are many charities and organizations that offer scholarships. Now, many of them are more towards research students, but they might be very interested in an exceptional master's student as well. So you can go on to, UCL has this database of funding opportunities, and it's quite comprehensive, with numerous grants and applications. But you might also find an organization that you want to write to because maybe you don't necessarily fit that grant application, but you might reach out to that organization to see if there's some scholarship opportunities. So when you go to that website there, and you can just remember that it's under UCL Doctoral Skills Development Program 2, you put in the PIN number 3098, and that will give you access as a prospective student to see what's there. If you're already at UCL, you'll just use your ID number and you can go right in there. Other additional things is, once students come, sometimes students have emergencies. So we do have a financial assistance fund. We have emergency loans. There are doctoral fellowships, student welfare support, all of these things. And if you're coming from the United States, actually, there are federal loans, and UCL does allow you to have those. And then, of course, there are private lenders. These are just two, LendWise and Future Finance, that lend and offer loans to students doing programs that need kind of a bit of bridging to meet their financial commitments. They're also for international students. I always say to go to the British Council. It's a very good resource, and you can learn more about these scholarships. So there are the Chevenings, the Commonwealth, the Fulbright, great, and master's bursaries. And then the other thing I would really encourage you to do is check out your Ministry of Health, your Ministry of Education in your home country if you're coming from abroad. They might also have scholarships that you can apply to. The other thing is that we don't talk as much about, but I think is equally or more so important, and that's your ability to work while you're here in the UK. Currently, there are lots of job opportunities in the UK. The labor market is actually, very buoyant and in need of people. So if you want to work alongside your studies, you can work up to 20 hours per week. And of course, during vacation periods, you can work more. So it's really an opportunity for you to have work experience and learn more about the UK. It can be a great way to meet people as well as supplement your income. If you've got questions about this, the other thing that UCL has is a terrific international student support team. And they can provide you with any kind of practical advice you might need, also around healthcare, banking, transport, just any information about your immigration and visa. So, and the other thing that's really important to remember when you come to study in the UK is that when you finish your studies, and sometimes, people often get internships or part-time jobs that actually lead to opportunities for full-time employment. So you can qualify for what's called, excuse me, a graduate route in so you get a visa that's available for international students, and it can allow you to stay up to 2 years post your studies to get work experience here in the UK. So it's a fantastic opportunity to really take what you've learned and apply it and get some extra work experience before you return to your home country. So again, just in conclusion, there are a number of places where you can learn about funding. You can go to our website and our funding, scholarships and funding. You've got UCL's students and funding. You've got the PG Loan Masters, so funding for postgraduate study through the government site, and then independent financial advice through moneysavingexpert.com. So these are all places where you can start to increase your knowledge and start to put together not just your costs, but your income and how you're going to finance your higher education. So that's really all that I've got today. I just want to tell you about an upcoming event. It is an in-person event. It's advertised on our website. It's Innovation in Healthcare. It'll be a panel discussion. It's on June 28th at 6 o'clock. So if you can join us for that event, it'd be terrific to see you, meet you in person, and have the opportunity to answer your questions. And again, you can always write to us, write to our admissions mailbox. Any questions that you have, please don't hesitate to ask us to come forward. We're always here to help. We want to support you. We want to make your application journey as seamless as possible, and also any way that we can answer your questions, engage with you, is always an opportunity for us. So that's the end of my presentation. As I said to you, I can already see we've got quite a few questions in the Q&A, so I'm really excited to answer those questions. Again, if you haven't put a question in there, there's still plenty of time. And I'm going to move now to the Q&A and stop sharing my screen. So thank you. All right. So the first question is there a scholarship for African female? There's not one specific for African females, but an African female can definitely apply for the Women in Healthcare Leadership Scholarship. And if you're doing the MBA, you can also apply to that Future Leadership Scholarship. How can I build my case to successfully earn a scholarship? I think the most important thing is to look at the different scholarship offering. And again, if you're thinking about 23, 24, which I assume you are, now is the time to really start thinking about funding options. Make sure to visit your British Council, think about a Chevening, other kinds of scholarships that might be available. The real trick to getting a scholarship is to tailor your application to what the donor wants or the person offering the scholarship. So I think it's taking your time. 500 words, for example, on the GBSH scholarships, that's not a lot of words. So you're going to have to be really quite greedy with your words and think about what you want to say. The other thing I want to really highlight with you, and I see this all the time, you know, it's much harder to write something short than it is to write something long. So you want to really have a structure, not waste space, answer the question, be as authentic with your answer as possible. And then last but not least, make sure there are no grammatical errors or spelling errors in what you send through. That is so integral. And I see sometimes people put together applications, and for the reader, you don't want them to be distracted by poor language use or slang or lots of extraneous information that only left you a sentence to really answer the essay question. And that's true with all scholarships. So people can maximize the ability to apply for grants and scholarships by thinking about how do you mold yourself around the donor. So also learn as much as possible about who offers that scholarship. Did you say the MBA includes 2 weeks in research in a country outside the UK? Absolutely. So our cohort for this year, for 22-23, we are anticipating 3 locations. One, we'll have a group of students who will go to Saudi Arabia, one that will go to Nigeria, and the other one will go to India. They'll be working on a project. They'll be given a case that they'll read. They'll have questions that they're going to address in their research. So it's an opportunity to really get an international consultancy experience. You'll have guest speakers, events, all your ground transportation, your food when you get there is all covered. We will have housing options so that it's very affordable for everyone, but also in line with your expectations and the flight. So we'll be putting the students into groups very early so that they can, you know, secure their flight and everything. So we'll try to really be cognizant of costs, but these are fantastic experiences for our MBA students. If I am not able to pay the application fee, what can I send as a proof? Well, we don't actually subsidize the application fee. And I would say if you cannot, you know, afford the application fee, then it would be really important for us and for you to understand whether or not you're going to be able to afford the program. You'll need to really think through all those steps. And you know, the worst thing is to apply to a program, even if we were to waive the fee, and then get accepted, accept that, and not be able to come because you don't have the funding. So I would really sit back and make sure that I've got the ability to actually engage and undertake the program, you know, as well as whether or not I need to have the application fee waived. If my grades are high, the GMAT will be waived. Not necessarily. So really, we waive the GMAT. We have to look at your transcripts and make sure that either you've taken some other kind of test, or your transcripts evidence to us your ability to perform in the program. So the GMAT isn't there just to be a hurdle to you participating in the program. The GMAT is there to make sure that you're going to be able to do the work. This program is a very fast-paced program. It's very intense. You're going to learn so much. So we need to make sure you're ready. So it's not just about your grades. It's about really what else you will be evidencing to show us that you can perform well and effectively in this program, both for you, because you don't want to get into a program, commit, spend the money, and not be able to perform and complete. If my university study was in English, is the IELTS waived? Again, it will depend on where you studied and whether or not our admissions team accept that. What I would recommend is that you write to the admissions directly to ask them whether or not. But if you're coming from overseas, normally you will have to take an IELTS. I'm really interested in joining 2022. If you want to join the MBA cohort for 2022, that window is closing pretty quick. We've already closed all the master's programs. The MBA closes on June 30th. So you would have to really get your application in as quickly as possible. If you've got any questions or you'd like to speak to the MBA director, I really encourage you to write to us. Is there student finance for the MBA? As I've already articulated, there is a scholarship. It is closed already now for 22-23, but it'll open up again for 23-24. And that is the Future Leadership Scholarship, which can be up to £15,000 to do the MBA. That scholarship is open for overseas students. So overseas students can apply for that scholarship. Overseas students can also apply for the Women's Leadership Scholarship. No, these scholarships are not full scholarships, so you would still have to find some financing or other scholarships to make up the difference. Can you have the presentation slide? I believe that the presentation will be put up on the UCL GBSH YouTube channel. So if you go to the YouTube channel for GBSH, you should be able to find these presentations. When you say exceptional, what is the criteria for exceptional? Well, that's a really great question. It will be people who can get into the program that have, achieved both in terms of their academic work, but more important, if it's the MBA we're talking about, we'll be looking for your work experiences. We'll be looking at your personal statement. We'll be looking to make sure that you have solid, excellent references. And when your references give you a reference, they give you a score. So we would expect that to be relative to the other, everything is relative to the other applicants for the scholarship. So we have a certain number of scholarships that we can award. We will award those based on those candidates who overall package, as just articulated, plus their essay are excellent. And then we'll give as many scholarships as we can. Can I apply for the GBSH Women's Scholarship after receiving an offer? It's too late to apply for 22-23 because we've already awarded the scholarships. The scholarships have a deadline. So in the future, if you're talking about 23-24, what I suggest that you do is you apply to the program and the scholarship at the same time. That way, if you get into the program, you can take the scholarship as well. Can one apply for more than one scholarship? Yes, you can apply for more than one scholarship. You can apply for all the scholarships that you qualify for. And like I said, these are just the department scholarships. You can also apply for scholarships at UCL. You can also apply for things like the Chevening. You can also apply for scholarships from other individuals. Good day. What is the due date for applying for the Women's in Healthcare Scholarship for 23-24? I don't believe that that's been posted yet, but we will have those up in September. So you can check back in September and you should see the deadline. It will most likely be around March time, into March, alongside the deadline for the applications. Is it too late to apply for the September 22? The only program that we currently still have open is our MBA in Health, the in-person MBA. That deadline is June 30th. So you can apply for that for this year, but the scholarships have now, all the scholarships or programs have closed for 22-23. Using the scholarship finder for Philippine scholarships resulted in 0 matches. Is this because 22-23 opening has already concluded for the UCL Medical School? It could be, or it could be that they don't have anything specific for Philippine scholarships. But you might check other sources, or again, go to the British Council and see what they have. But I would assume that most scholarships now have closed for 22-23. We're really talking about 23-24. Hi, Nora. Will you be able to explain the course fee split for term 1, 2, and 3 for biotech and pharmaceutical management? Well, just off the top of my head, it would be just around 9,000 and something for term 1. Then you pay that again in February for term 2, and then again in term 3 if you're an overseas student. If you're a home student, that'd be about 5,000 and something for term 1, 5,000 something term 2, 5,000 and something for term 3. That's assuming also that you have no scholarship. Is there a minimum age for the scholarships? No, there is no age, but you do have to be able to be accepted into one of the programs. All the scholarships will be used against your tuition. Is an international student eligible for the Roche Scholarship? No, the Roche Scholarship, which has already been awarded for this year, was only for a UK student. Hi, I want to ask if my country provide a scholarship which requires us to come back to our home country for a couple of years after we finish our studies. Does the postgraduate visa still can be issued? I honestly don't have an answer for that question, but what I suggest you do is that you Google the UCL International Student Support Team and ask them that question. I'm sure they'll be able to get right back to you with an answer. How much can we expect the return on our investment after completing the MBA Health in UCL? Well, that definitely sounds like an economic question. I would imagine, the MBA from a top 10 university in an area of health will be highly sought after. So, of course, it's not so easy as to guarantee you a salary or a job. But I would imagine that when you finish this program, it will be a transformational experience. You'll change a lot. You'll grow your abilities to think. And we'll be working with you from the very beginning, really forging your career, making sure that you are able to take advantage of the opportunities that come along. Every week you'll have career speakers, but more importantly, you'll learn how to articulate yourself to operate on a kind of a global scale. And I would imagine that that will make you very attractive, particularly given that healthcare is an area, regardless of the economy, that is highly valued and highly needed, particularly today, particularly in countries where populations are rapidly aging. What is the application fee? I'm not sure what the application fee is. You'd have to check on the website to know that. If someone's applying for a scholarship, the application fee will be waived? No, we don't waive application fees. In the website, the personal statement is 3,000 words, not 500. Yes, that's correct. 500 is for the scholarship. It's a separate process than applying for the degree, the program. So the personal statement for the program can be up to 3,000. I wouldn't recommend writing 3,000 words. I don't think you need 3,000 words, but that's a separate process than applying for a scholarship. For the scholarship, the request is for 500 words. Okay, well, I see that's all the questions. I'll wait just one more minute. If you've got any other questions, I'd be really happy to answer those questions. It's been a pleasure talking to you, and I really appreciate all your engagement, all your questions. I can see many of you are very serious about coming and joining us. So I hope that I've answered your questions. If we can be of any further support, please let my team know, write to the admissions, and really have a wonderful afternoon. Thank you so much. Take care. Bye.